In the United States?
Yeah.
It's a disgrace.
What do I think of healthcare in America? Yeah. I think it sucks.
I think it's too expensive. I think other countries have a lot better healthcare than we do over here.
I can't afford it.
Yeah, I think that there should definitely be better access to healthcare for people who don't have healthcare provided by their jobs, like what Canada has with the socialized healthcare.
I wouldn't get sick in this country.
Yes, it does help to be a professional. Yes, it does help to have a college education. Maybe that's another issue. So personally, I don't have any quips or gripes with it. I know some people do because they can't afford health care today. I suspect it has something to do with the cost of liability insurance for doctors.
Honestly, healthcare in America is great if you can afford it.
A lot of people in this country, and especially a lot of children in this country, don't have health care coverage. And that, to me, that's just appalling.
Well, it's hard. It's hard because, well, once I had to put my daughter on the hospital. She needed surgery, and I still, with that bill, and it's pretty high, it's like $20,000. And I mean, it's bad when you don't have any kind of insurance.
We are the richest country in the world, and per capita, we should be able to easily afford what other countries actually take for granted.
We have the best health care in the world, but if you're really in trouble and you don't have any money and you don't have any insurance, you're not getting squat.
Emergency care in the United States is horrendously expensive. In college, I was playing basketball, pickup game basketball in the gym, and came down and twisted my ankles a bunch of ways. And the bill from the emergency room, 3 hours in the emergency room, was $6,500.
If you don't have insurance and you have to go into the hospital for an appendicitis, a gallbladder attack, something that happens to people, but it's not really regular, but is kind of normal, happens to some people. You're going to come out with a $15,000 bill.
Denver Health Medical, I owe them right at $45,000.
Here, where you can't have preventative or maintenance care, people just go to the emergency room when they've got some kind of problem.
Like I need to see a dentist. Now when my tooth is rotting, like at Christmas, they pulled it out. They had to use a surgeon, a doctor, and a nurse. But how about just a simple checkup once a year? That they won't pay for.
There should be a lower level beyond which you do not let your citizens fall. You do not let children die on the street with no health care and no food and no place to live. I mean, there's no need for it. There is so much wealth in this country that there is no need for that to happen, and yet it does.
People can't afford insurance. There should be a national insurance program like they have in England, like they have in the Scandinavian countries or Canada. Why are we spending $100 billion to invade Iraq and another $110 billion to rebuild Iraq? And there's people in the streets of America that don't have food, can't go to a dentist, can't get eyeglasses.
People can't get health coverage because they can't get the insurance because either they're unemployed or they don't make enough money or they're partially employed.
In the trades, in this country especially, there is not a lot of employer-provided health care.
If my employer didn't pay for most of it, I wouldn't have it at all.
You're screwed if you're the majority of the population, which is middle class. Because you don't qualify for low income, but you don't have enough money to pay for this treatment, that treatment. I mean, that the treatments are out there.
For people in Australia, you do not want an American style of insurance coverage, an American style of healthcare system. That would be a step backwards.
And that while free trade and liberalization, could be all great, and that's what the government's push, and it's so great, you have to really look at what the costs are, what the social costs are to our standard of living at home. Because what do we want? What are our values? What are our ideals? What do we stand for? Do we believe that everybody should be able to go to the doctor when their child is sick?